Welcome to Simple Science with Professor Myers, where we take complex science topics and make them into small, easy to digest bites for the average viewer. Today we're going to be talking about the introduction to anatomy and physiology. First question is, what is anatomy and physiology? Doesn't matter who your teacher is, they're going to ask you this question on an exam. Anatomy and physiology deals with your body parts, their structure, along with their function. Anatomy is simply the structure of the body part. Physiology is going to be the function. It's easy to remember the difference because think of the word phone. It's PH. So physiology, function. Anatomy and physiology are dependent on each other. I need to have a proper structure in order to have a proper function. This is the principle of complementarity. So if I take my bicycle, for example, I have wheel A, B, or C available to me. I'm going to pick A because A is going to allow my bicycle to function properly. If I have the wrong shape, I can't function properly. For example, if we look at the urinary system, if I have my bladder located in a different spot or it's deformed, it's not going to perform normally. Next, we're going to look at homeostasis. Homeostasis is the ability of the body to maintain a relatively stable internal environment no matter what's happening in the outside environment. This isn't going to be a set point. This will be depicted as a range. Homeostasis requires three main components. You're going to have a receptor, you're going to have a control center, and then you're going to have an effector. What the receptor is going to do is it's going to monitor the environment. It's going to be looking at a variable. The variable is what it's looking at. It's the event that's going to be monitored. It's going to look for a stimulus, which is a change in that variable. It will then report to the control center. The control center will determine whether or not it's in the normal range. It will then tell the effector to do whatever effect is determined appropriate by the control center. Let's look at this generically. So if we have a variable, we have a stimulus, which is a change in the variable. This will be noticed by the receptor. The receptor will send an impulse along the afferent pathway towards the central nervous system or the control center. This control center will look at it and see if it's in the set range. If it's not, it will send an efferent impulse to the effector. The effector then will carry out whatever effect the control center deemed appropriate. Afferent and efferent are easy to remember. A comes first alphabetically, so it's towards the central nervous system. Efferent comes second, so it's towards the effector. Homeostasis is maintained by two different types of feedback, positive and negative. In negative feedback, something happens, goes away from the set point. So body temperature, for example, drops. Your body responds by increasing your body temperature. So that's it. Something goes wrong, your body compensates by doing the opposite. That's negative feedback. In positive feedback, the opposite happens. So some abnormal thing happens, and your body causes it to continue to happen. So, for example, you have contractions. Contractions cause you to release oxytocin. Oxytocin causes you to have more contractions, which then causes you to release more oxytocin. And that happens until you give birth. So these tend to be explosive and aren't as common. Let's look at directional terms next. This tells you where something is in relationship to something else in your body. So for example, our first one is superior or cranial. These mean above. Cranium, head, it's on top of you. So your nose is superior to your mouth. It is above your mouth. Inferior and caudal mean below. So think about you coddle a baby down by your belly button. That's below your head. So for example, my chin is caudal or inferior to my mouth. The next set of terms we're going to look at is whether or not it's towards the front or the back of you. Ventral or anterior mean towards the front of you. So for example, your stomach is anterior to your back. When we're looking at dorsal or posterior, we're looking behind. So it's towards the back of you. So your butt is posterior to your abdomen. Another set of terms are going to be medial, lateral, and intermediate. When you're dealing with something that is medial, it's middle. So it's towards the median of the body. So for example, my nose is medial to my cheeks. It's in the middle of my body compared to my cheeks. Lateral means towards where your limbs are, so towards the edges. So my ears are lateral to my nose. So they're towards the side. Think of the L pointing one direction. Intermediate is between two items. So my collarbone is intermediate between my shoulder and my breastbone. The next set of terms are unique. They deal with the arms and legs only. So the first one is proximal. Proximal has a closer proximity, or it's closer to the body trunk. So my elbow is proximal to my wrist. My knees are proximal to my ankles. Distal is the opposite. It's in the distance compared to the other item. And it's in relationship again to the body trunk. So my wrist is distal or in the distance compared to my elbow. My ankle is distal or in the distance compared to my knee. The last set of terms we want to look at is going to be how deep into the body it is. We have superficial or external. These are towards the surface of the body. So if I'm a superficial person, I care about what's on the outside. So your skin is superficial to your muscles. Deep and internal is the opposite. So it's inside the body. So it's going to be deeper. So my skeleton is deep compared to my skin. If you liked our content, please subscribe to our channel. Also, we have some books available online on Amazon. They include the Introduction to Anatomy and Physiology, the Endocrine System, Respiratory System, along with blood. More titles will come in the future. Happy studies. See you later.